whereby most of our sex workers, they get mistreated, they get harassed, they are get killed out there, and because there is no fund to support them in these policies, they most of them they even get themselves killed. So that is one of the things that has really affected them. Another part that comes in is whereby most of our sex workers, they do not have any place to go right now because there is no key populations in the facility. So when they get to the facility, they cannot get, most of them, when they get to the facility, that time of key population, they could just go direct to their special doctor. We used to have this term whereby when you get to the facility, you just say that I'm coming for happy hour. When you go there, use the word happy hour, they know you're in key population and they direct you direct to the doctor and they handle you. Most of them, they are very impatient. Some of them are in drugs, so they can never sit there and wait. Right now, it is not there. They cannot come and wait. Another part that I look at, we have lost our dice. The dice is whereby most of them, it was like a safe space, whereby you go there, there are doctors, there are facility health workers there are all the drugs, there are family planning, mental health workers. Right now, we have lost most of them. Actually, in Mombasa County, we have less than 3 dices, so we do not have it. And another thing that I can say is this, that most of our mobilizers, they lost their jobs. They used to go and mobilize. Right now, they don't have anywhere. They did not have jobs because of the stop work order. They could not even. Most what we used to do, we get the sex workers, we train them to be the mobilizer. Now most of the mobilizers have gone back to the street to be sex workers because they don't have source of income. Our outreach workers also, they used to get their stipend there, they used, and when the stop work order came, they did not have the jobs. They are back to the street. So at the moment, what I can say, that effect has become so high on us, that we are trying so much to curb the pressure, but it's becoming so hard. Another thing that I can talk about is LGBTQs. They're actually being killed because they do not have any policy to protect them. They do not have any sex, but they do not have anywhere to go. So they hide themselves. They have gone back to their closet. They cannot do anything to economically empower them because they will be judged out there. They will be killed out there. And I can go back to the how my one of the members has just said that we don't, because of the drugs, people, we are getting more infected people. As I said earlier, last month, the month of April, actually in my scope, I got five new. This month of May, I've got already one new. So the effect affected people, and it is becoming so high, in which we could take even 6 months to get even one. But right now, within 1 month, I have 5 of them. And then we get pregnancy. It is becoming so high. Girls are dropping out of school in a rapid way that we do not know even how to handle it. Their mothers, these mobilizers, outreach workers, their parents, they lost their jobs immediately. Their kids are at home, they're not going to school, they do not have food to give them. So it has affected us from zero. Like, the kids are getting affected, the parents, the mother. Mental health part, we used to have classes for mental health, sessions for mental health. Right now, we do not have even space for mental health therapy. We do not have even a therapist for mental health. We used to have a place for health gossip, whereby they can just come and have health gossip. and talk and refresh their mind. Right now, it is very difficult. We are really trying with the little we have, but we are not having even 20% of them. Another thing right now that has affected us so much, we cannot access, our scope is big. We used to have these stipends and some facilitation, transport facilitation to go where these ladies are, where our people are. Right now, our mobilizers, they don't have even transport to go there. So it has become so challenging to us as an organization, basically, to a point that actually right now we are working with the people who are very close to us, whereby we can actually just walk to that place. Anything that needs financial support or we walk to that place, we cannot handle it. But whatever small we can do, we are doing it. Thank you.
Thank you so much, Lulu, for sharing more about what this means for the community that you work with. Judith, I'm going to ask you the final question, just so we can keep things moving forward and get to the audience Q&A. I know we just have about 10 minutes left. So can you share with us briefly if your organization has a path forward, if that's a conversation that's happening amongst you and your colleagues now?
Thank you, Lauren, for the question. Yes, we've been having a lot of this conversation, and we just want to see what is the way forward. Yes, we have no control over Trump. Again, he normally say, USA is our country. We know what we want to do with our money. So what are we going to do next? So first thing, we started accepting, and also we just think of maybe doing some local fundraising with the people that are around and the people that are able to support even without USAID. And we've been scanning around just to see who are there, who other people can they support these health repercussions. So that is one of the things. And then again, we started doing budgeting and financing planning, because again, you realize, yes, with the program that we are used to, maybe we were doing a lot, maybe we were doing excess of the things that we are doing. So can we somehow cut? Can we somehow cut those or reduce what we meant? Like, for instance, if it is a TCS to come again, if the clients are supposed to come to the hospital, can we give like 100 clients in our same day, and we see how we can use the small resource that we have so that we are able to budget with what we have. The other thing that we've been thinking about and around is just advocacy to the government. It's high time that the government should know that we are his people. Maybe we just need to know, we just need to start using the data that we are providing, so that the government is able, with the little resource we have, we are able to work with what we have. Because you realize now, from the cutoff of the funding, and most of our ARVs, the regimes that we are using, we are being supported. And you see now, if, for instance, if there will be no support of any of those drugs, remember, we already have people that are already positive who are using. And so this will lead us to them to have their viral loads to be high. And again, most of them, they'll meant to go to the next level of a regime, which is very expensive. So if the government, they are able to understand and able to help to come in. You see, most of these stakeholders meeting that we've been doing, the government has just been either just listening, you know, but now they need to come in, just know what is happening with their community. So these are the conversations that we've started moving around, and also trying to see other donors that they're able to support us, so that just to help, because we have those key vulnerable in the HIV sector that we can't just leave them without helping them. Even as we say that our government is able, but again, can we have other people who can really support these programs? And again, the other thing, accountability. You see, it's true, there have been a lot of inaccountability from some of the organization. Maybe that's why it has led to us. So we need to sit down, even as we blame Trump. What has happened? What has it been happening? Can we do it?
Judith, we've just lost connection with you.
Daily reporting, a daily accountability process, that monitoring and evaluation, so that just to help this donor know that their money, their resources are really touching the hearts of the people. So these are the conversation we've been doing, going forward with my fellow colleagues and stakeholders meeting that we've been doing. Back to you, Lauren.
Thank you so much. And your response is a great lead-in to a question that we got in the Q&A function. So Willis and Lulu, I invite you to respond to the question from Gregory, which is, are there any other countries, or are you seeing any other countries or donors who are stepping up to fill any of the gap in aid funding that was lost from this?
Thank you, Lorraine. What we did immediately after the stop work order, we started doing the transitional to hybrid funding model, whereby we could combine different international grants plus the local partnership. Basically, at the moment, we have partnered with three main organizations. That is San Frontier, MSF, there is Trigger Rights, and there is an organization called HF Fund. So this partner, after partnering with them, they are actually supporting us. Like, let's say San Frontier, they have carved most of our hotspots, most of our regions, to help the girls with family planning. They are supporting us with PrEP and HIV testing. They have come with family planning. They come to hotspots. They go for outreach work. So most of them, when you come to Trigger Rights, the Trigger Rights also have partnered with us immediately. They're also doing the same thing with some regions in our own area, the scope that we are handling, in which it's 2 sub-counties, that is Kisauni and Inyali. So we have partnered with HF Fund. HF Fund at the moment, what they are doing with us, we have come up with the economic empowerment activities whereby we are training our mobilizers, we are training our peer educators. At the moment we have started, we launched it last week, whereby we are training our peers and our mobilizers and outreach workers with economic empowerment activity like tailoring. We have started tailoring. We have 200 peers that are training right now. We have artisan training, whereby they are training so that they can have the skill, in that when something like this happens again, they do not go back to the street, but they have something in their hands that they can work and get their own money. They can self-employ themselves. And that is what we have tried to do, and we have partnered with other organizations. We have local funds too, whereby we deal with them and they support us. We have worked so much with our county government. So our county government also has come in let's say, for example, of MPOX, they are the ones who are training our mobilizers so that they can go to the society, they can go to the people and teach them how MPOX comes in and the impact and effect and everything about MPOX. So we have tried so much to bring in together a lot of combination of different funders so that we can still move forward. We should not drag behind again. Instead of, yes.
Thank you,
Instead,
Lulu.
thank you.
Yeah,
Thank you.
appreciate you walking us through the additional donors that you're working with. And I do want to just add that the gap that's left by the US government pulling out of this funding is so vast. The US government was the largest funder of international family planning and the largest funder of global health support. And so while there are countries who are stepping up, I think the gap is still very great. And to that point, I would like to invite you all now to take an action to support the United Nations Population Fund. There is a bill in Congress called the Support the UNFPA Funding Act. So my colleague Rory is going to drop a link in the chat that you can take action on. It is a quick action to support UNFPA, and it takes just a brief amount of time, a minute or less, and would help ask your members of Congress to co-sponsor that and take a stand in support of funding for UNFPA, which does vital work around the world to support access to contraception and maternal and child health and many other things. Rory is also going to drop in the chat a link for demanding that your member of Congress restore global health funding now. It only takes, again, a minute. It's a very quick action that you can take to make sure that your member of Congress and your elected officials know that this is an issue that you care about. So there's 2 actions that you can take in the chat. And I'm just going to bring us to a close with less than 1 minute left. I'll try to be quick and mind everyone's time. So just to wrap up, we heard from Willis, Lulu, and Judith the real life impact of this US policy decision and how devastating it has been. And we learned that beyond the impacts on healthcare, like access to antiretroviral medications, contraception, especially for teenage girls, tracking and responding to diseases like MPOX, and support for breastfeeding mothers who are HIV positive. We also heard from Willis the impact on governance and how that could lead to an increase and a rise in gender-based violence. And then from Lulu about how the mobilizers that she works with are now losing their access to income and turning back to sex work in an environment that doesn't support them having access to the prevention and medications that they need to do that work safely. So I want to immensely thank our speakers for taking the hour to stay with us this afternoon or in their evening and just share with us what the impact they're seeing on the ground is. I'm not sure if there's a clap function in this Zoom meeting, but if there is, I encourage everyone to use it. And then the last action I'm going to have Rory put in the chat is, if you haven't already signed the pledge to fight for her, fight for health, empowerment, and rights, I encourage you to sign the pledge now and commit to fighting for health, empowerment, and rights for all people everywhere, to have access to contraception and access to make the decision about if, when, and how to have their families, and to live a safe and healthy life. So Willis, Lulu, and Judith, thank you so much again for your time. We really appreciate it. I know our members and the audience really appreciates your insight and your willingness to share with us. There you are. Thank you, Judith. Really appreciate it.
You're most welcome. It's a pleasure.
Thank you, Willis. Thank you so much. Thank you, Lulu. Hope everyone has a safe rest of your day.
Thank you so much for the opportunity to share.
You too have a great day ahead. And thank you so much. Say hi to Rebecca. Rebecca
I
too.
will.
Have a great day. And the
Thank
rest of the
you.
family.
Okay,
Thank you so
Gregory,
much.
good point.
Bye-bye.
Bye, Lulu. Thank you. We'll keep the chat up so that everyone has a chance to take action at the links. And I know some people were dropping news articles, so we'll keep the chat open just another minute or two longer in case folks want to click all of those. Thank you so much for that request.